If you're enjoying this MedPrep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called MedPrep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
When evaluating potential hires for your small business, it's essential you look beyond resumes. Sure, a candidate may appear impressive on paper, but understanding the person is crucial. LinkedIn, the world's largest professional network, provides a complete view of your candidate's skills, experiences, and interests. With LinkedIn's up-to-date data, you can be confident that you really know who you're hiring. Post your free job at linkedin.com/achieve. That's linkedin.com/achieve. Terms and conditions apply.
Every who down in Who Newville liked the holidays a ton. But where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Hi, and welcome to the MedPrep to Go podcast. I'm Dr. Raj, and what is our mission here at MedPrep to Go? Is to improve medical student wellness and reduce educational debt by providing a high-quality USMLE question bank in an online and audio format, by making medical education material available to study on the go. We strive to give you time back in your day and to focus on your health and well-being. And today, I will be reading 3 USMLE high-yield questions. Today's subject will be microbiology. So let's start with our 3 questions. Question 1. An 88-year-old woman is brought to the clinic by nursing home facility personnel for follow-up on a poorly healing wound on the medial side of her right fifth metatarsophalangeal joint. She has severe dementia, which is very unfortunate, type 2 diabetes. She finds the feeling and taste of saliva in her mouth to be unpleasant and refuses to swallow it. She allows it to build up in her mouth until she spits it out, or a member of the nursing home personnel wipes it out of her mouth with a tissue. She fights back against bulbar aspiration. She is particularly susceptible to infections of her lung. By which of the following etiologic agents? With what etiologic agent? With what associated characteristics? Interesting. So we have a kind of like a 3-part question. So they want to know what infection she's susceptible to, given the fact that she is older in age, she has dementia, sounds like she's building up a lot of food in her mouth. And we're talking about, infection in her lung. And it sounds like we're kind of leaning towards aspiration. And the question also continues by asking, with what etiologic agent and what characteristics does this agent have? So is it going to be choice A gram-negative encapsulated rod that is resistant to extended spectrum beta-lactamases that is found with other organisms and more commonly affects the right lung, okay? Or B, a gram-negative rod living in Obibe with alveolar fibrinopurulent exudate? Is it a C, a gram-positive coccus in clusters, which is resistant to methicillin, and that may give rise to pneumatoceles? Pneumatoceles are like little blubs in the lung. Is it D, an acid-fast bacillus with a GON complex? Or E, an obligate intracellular bacterium with a biphasic life cycle that creates inflammation primarily in the interstitium. All right. Well, this is kind of a little tricky one over here, but, when I hear the word older in age, nursing home, lots of aspiration, definitely you would think that she would be someone who's more predisposed to a gram-negative bacteria. I think they're trying to go with someone who's going to have resistance. So the choices that they have here, it really looks like, choice A with resistance, which is that those ESBLs kind of sounds like the organism they're going for. So, before you even look at the answers, I'm going to choose A as an apple. Let's see where we go with this. And the correct answer is it's a gram-negative encapsulated rod that is resistant to extended spectrum beta-lactams. So what is going to be that encapsulated gram-negative bug? I'm going to think about Klebsiella. I think that's what we're going with. Is found with other organisms and more commonly affects the right lung. I think they're going with commonly affects the right lung based on the aspiration, but in general, you could get Klebsiella pneumonia in any of lobes of the lung. It doesn't necessarily have to be only associated with aspiration. And the answer here, they said that gram-negative encapsulated rod is resistant to extended spectrum beta-lactamases. That is found with other organisms and more commonly affects the right lung. This describes Klebsiella. The saliva buildup in the patient's mouth increases the risk for aspiration pneumonia, which it does, but she could be aspirating other types of bacteria also, which is often polymicrobial. There you go. These factors combined with her age and the poorly healing wound likely related to type 2 diabetes points to bacterial pneumonia. I think a key teaching point over here is that when we talk about patients that come from nursing homes, in the olden days, we used to call those healthcare associated pneumonias, but we really treat them like community-acquired pneumonias now for one reason, is because the minute we say that they're kind of like these hospital-associated nosocomial pneumonias, we start treating them with very broad spectrum antibiotics up front, which really builds up resistance. So even though they wrote the word nursing home over here, I feel that it doesn't necessarily mean this patient needs to have, an ESBL. I think I would think about an ESBL in someone who has had previous multiple courses of antibiotics, history of resistance, but of the choices here, this sounds like the most reasonable one. Choice B is wrong. A gram-negative rod living in amoebae with alveolar fibrinopurulent exudates describes more of a Legionella pneumonia in this case. And I would think for a Legionella pneumonia, for your USMLE, someone who has known risk factors, whether it be air conditionings or water supply, history of diarrhea, having a low sodium level, which is not this question. Choice C, a gram-positive coccus in clusters, which is resistant to methicillin, that may give rise to pneumatoceles, is incorrect. This describes someone who has Staph aureus in this case. Even though you can aspirate staph and strep into the lung, given the description that we have here in the vignette, that it sounds like someone who has more of that gram-negative encapsulated rod seems like a better answer. So C is wrong. Choice D, an acid-fast bacillus with the GON complex, is someone where we think more about tuberculosis, which we don't feel in this question. Choice E, an obligate intracellular bacterium with a biphasic life cycle that creates inflammation primarily in the interstitium, is incorrect. This is kind of describing the chlamydia pneumonia, which we don't see a lot of clinically. So what is the key learning point here is that identifying the likely etiology of pneumonia is based upon clinical settings, anatomical distribution, the nature of the host. Reaction is also very important. And of course, when we think about Klebsiella pneumonia in a different setting, especially in a hospitalized setting, in the medical ICU, somebody who's had multiple courses of antibiotics, I do worry about resistant bacteria. Definitely one type of resistance I worry about are people who develop ESBL. Also, with a lot of antibiotic use, you always worry about something even worse, which is CRE, carbapenem-resistant Enterobacter. So these are ones we worry about quite a bit. And that was a really good question. I hope you enjoyed it. Let's do our next question, which is a 2-year-old boy is brought to the physician because of a 2-day history of musky smelling urine, irritability, and decreased appetite. He has a past medical history of a congenital ureteral stricture. He has been treated with antibiotics for recurrent urinary tract infections in the past 6 months. Vital signs and temperature are 37.8 Celsius, 100.4 Fahrenheit, heart rate of 80, respiratory rate of 20. Physical exam shows suprapubic tenderness. Lab studies show gram-negative modal rods, which are urase and nitrate test positive. Which of the following lab characteristics will most likely also be observed with this causal agent? Is it A, catalase positive, swarming colonies on solid agar? B, H2S negative, pink mucoviscous colonies on McConkey agar? C, oxidase negative, green iridescent colonies on eosin methylene blue, otherwise known as EMB agar? D, oxidase negative, no growth on McConkey agar? E, oxidase negative, pink colonies on McConkey agar? And the correct answer here is going to be A, catalase positive swarming colonies on solid agar. This patient has a congenital condition that obstructs the flow of urine, predisposing him to urinary tract infections. The causative agent is gram-negative and urase positive, which is consistent with Protease mirabilis. The other possible gram-negative cause would be coli, but that organism is urase negative. Answer choice B, H2S negative, pink mucoviscous colonies on McConkey agar is incorrect. This describes Klebsiella pneumoniae. Choice C is incorrect. Oxidase negative, green iridescent colonies on eosin methylene blue agar describes E. coli. Answer choice D, oxidase negative, no growth on McConkey agar is incorrect. This describes Staphylococcus saprophyticus. Answer choice E, oxidase negative, pink colonies on McConkey agar is incorrect. This describes E. coli. Key learning point here is Protease mirabilis is a gram-negative modal rod, which is urase and nitrate positive, catalase positive, and demonstrating swarming colonies on solid agar.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Here's my 30-second story with Guinness. As soon as my sister and I get home for the holidays, we don't even unpack. We head straight to our pub. The bartender already knows our order, Guinness and fries. We laugh all night, catch up with old friends, and walk home with faces sore from smiling. It's one of my favorite nights of the year. That was my 30-second story with Guinness.
Guinness Draft Stout. Please enjoy responsibly. Imported by Diageo Beer Company, USA, New York, New York.
Let's do our last question. A 19-year-old woman presents to the student health clinic with concerns about a lesion on her genital region, which she noticed 3 days ago. She is sexually active with multiple partners and takes a daily oral contraceptive pill. She does not use barrier protection. Her past medical history is unremarkable. Careful workup indicates that she has contracted a sexually transmitted infection caused by an intracellular organism that is poorly gram-staining. Which of the following best describes this patient's most likely presentation? Is it A, grouped painful genital vesicles with fever and arthralgia? Is it B, painful genital ulcer with unilateral inguinal lymphadenopathy? Is it C, painless genital ulcer with bilateral inguinal lymphadenopathy? Is it D, painless genital ulcer without inguinal lymphadenopathy? Is it E, painless inguinal ulcer that bleeds upon contact? And the correct answer here is D, painless genital ulcer without inguinal lymphadenopathy. This patient is presenting in the early stages of lymphogranuloma venereum, LVGV, caused by chlamydia trachomatis, serotypes L1 to L3. Bilateral inguinal lymphadenopathy will develop after the ulcer has disappeared. LGV is associated with newly diagnosed HIV infections, as well as other STIs. So this patient should have screening for other STIs. Answer choice A, group painful genital vesicles with fever and arthralgia, is incorrect. This describes the lesion of herpes genitalis caused by herpes simplex virus types 2, most common, and 1. Answer choice B, painful genital ulcer with unilateral inguinal lymphadenopathy, is incorrect. This describes the STI chancroid caused by Haemophilus ducreyi. This organism is gram-negative and classically appears in a, quote, school of fish, end quote, arrangement on microscopy. Answer choice C is incorrect. Painless genital ulcer with bilateral inguinal lymphadenopathy is wrong. This is the typical presentation of primary syphilis caused by the spirochete Triponium planium. Answer choice E, painless inguinal ulcer that bleeds upon contact, is incorrect. This describes a granuloma inguinale, also known as donovenosis, which is caused by Klebsiella granulomatis. This is uncommon in the US. So what is the key learning point here is lymphogranuloma venereum, LGV, is caused by an intracellular organism, chlamydia trachomatis, and presents initially with a painless genital ulcer, which typically resolves before development of bilateral inguinal lymphadenopathy. I hope you enjoyed these questions today, which are going to be high yield on your USMLE Step 1 and COMLEX Level 1 board exams. I'm Dr. Raj. Be sure to follow me on social media platforms and check out my book series published by Elsevier for Steps 1 and 2. It's my morning report series. We have medicine and surgery and peds and OB-GYN, all the core rotations that we need to do great on your boards. And I have a basic science series called Case Reports Beyond the Pearls. And we have wonderful basic science volumes such as pathology. And I hope to see you again on our next group of questions for your board exams.
Been out here all morning. Not a single bite. Guess the fish finally figured it out. Just like hackers do when Cisco Duo's on guard. With Duo's end-to-end phishing resistance, every login, every device, every user stays protected. No hooks, no catches, no bites. Cisco Duo. Phishing season is over. Learn more at duo.com.